Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Michael Fine. He's a family physician and he co-wrote the Kevin MD article in memory of Bernard Lown. Michael, welcome to the show.
Thank you very much for having me. It's great to be here.
So we'll get into our article in a little bit, but first off, can you share your story and journey to where you are today?
I'm a community organizer turned family physician. I got to start the largest family practice in the little state of Rhode Island. That practice helped found the DPC movement many years ago in about 2000. I then became the director of the Rhode Island Department of Health, a position I served in for about 4 years till 2015. Along the way, I got to write a couple of books, one called The Nature of Health, one called Healthcare Revolt, a novel and a book of short stories, and became convinced that the only way to fix the incredible mess that we call healthcare is by organizing healthcare workers and physicians. And as part of that, I got to become part of the board of the Lown Foundation, the Lown Institute, and then I got to meet Dr. Bernard Lown himself, who was a real giant in medicine and in my personal life.
Your position as a public health official during the pandemic, what would you say were some of the biggest challenges that you faced?
Well, the biggest challenge was that we don't have a healthcare system in the United States. We have a market, not a system. And that means we have no way to reach every single person. In the community in which I worked, about 50% of the population has no primary care and no access to care. And that made things incredibly challenging. In addition, we had to look at the great social discrimination that exists so that people who are at greatest risk had to go out to work regardless. And they picked up disease at work and brought it home and spread it at home. And that's why our densely populated cities and communities got so badly impacted.
I'm a primary care physician myself. I'm an internist, and I'm certainly interested in hearing your thoughts on the future of primary care. I'm certainly aware of the issues as you describe them, but in terms of big picture ideas that you have to save primary care going forward, what would some of them be?
Well, the biggest one is that it's going to take a movement. This is not something that's going to happen because someone passed an act in Congress or in a state legislature. It's not going to happen through reimbursement reform. The reimbursement reform is 30 years late. It's going to happen when we all get together, stand up together, and make it change. We have incredible power as primary care clinicians if we just would finally use it. You know, you take something like the home health certification and plan of care. That's a form we all have to fill out. We all hate. It is totally meaningless. It comes from CMS, and it will change if we force it to change, if we band together and stop doing it. Stuff like that, you know, I sometimes say we need to occupy CMS in order to change this. But it's not going to come from somebody else. It's got to come from us and our resolve, focus, and organization.
I think one of the issues when it comes to organizing physicians is that we're very siloed. Even among primary care, we have internists, we have family physicians, and we don't have a unified voice speaking for all primary care physicians in the United States. So when you say that there needs to be a movement and we in primary care need to act as one, how do we go about doing that?
Well, that's going to take years of movement building. You know, there are plenty of examples in American history where the United States has been made better, more democratic, more interesting by social movements, from the abolitionist movement to the movement for women's suffrage, to the civil rights movement, to the anti-war movement, to the movement for marriage equality. All of those fundamentally changed American society. And that's what it's going to take to fundamentally change healthcare in the United States. We are the people who are best suited to build and run this movement, but it's going to take work and sacrifice. It's not fair. It's too much to ask of busy primary care clinicians who are, slammed left and right every day, from their EMR to CMS requirements to this and that. The problem is there's no one else to do it.
So let's transition now into the Kevin MD article that you co-wrote. It's titled "In Memory of Bernard Lown." Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to co-write it?
Well, Dr. Lown was a major influence in my life. He died in February at age 99. He had an incredible life story, and was incredibly dedicated to medicine and to listening to patients. As some people may know, he invented the defibrillator. He described the contemporary treatment of myocardial infarction, post-myocardial infarction. He described a aberrant conduction pathway, the second most common after WPW, et cetera, et cetera. And then in his 60s, he worked to create an organization called International Physicians to Prevent Nuclear War, which did exactly as I said, which brought together hundreds of thousands of physicians from around the world. And they worked together and forced the nuclear disarmament of the late 70s and early 80s, a body of work for which he received the Nobel Peace Prize. So he was, that's the objective evidence. The subjective evidence was, when you spent time with Bernie, he was the smartest man I ever met. He knew more medicine than I can imagine. He started by testing people's ability to know, how much medicine you actually knew. And then he would tell stories about his organizing work, about his work around the world, and encourage everyone he talked to get involved, to get active, to listen to patients, and to really build on the beauty of the patient-physician relationship. He was just an amazing guy. And he brought to medicine something that I fear sometimes we lose, and that is an aware social conscience and a deep commitment to the relationship between physician and patient.
I talked to a lot of physicians on this podcast, and of course, a lot of physicians write on Kevin MD, and there is almost a sense of demoralization, of burnout, of moral injury among clinicians today. What would Dr. Lown say to these physicians who are maybe burnt out and thinking of leaving medicine?
He would say exactly what I hinted at, which is don't mourn, organize. He and I had a conversation a week or two before he died. We would talk with some frequency because he was my mentor and teacher, almost kind of a father figure for me. And I was dispirited. Things were bad in the country and things were bad in healthcare. I feel terribly about how we performed with COVID. From my perspective, we lost 500,000 lives unnecessarily. And Bernie at 99 said, I'm hopeful. People have no choice but to organize themselves and fix this mess. And that's what I think he'd say to our dispirited colleagues. We've been beaten up by the insurance process. We've been beaten up by CMS. We've been beaten up by pharmaceutical companies, et cetera, et cetera. We can either stay beaten up or we can join together and fix this mess. And we are the best suited people in the nation to lead the nation to a healthcare system that's for people, not for profit.
Now, if I'm in the exam room talking to a patient, examining a patient, what would some of Dr. Lown's lessons be specifically in the exam room?
I think they would start by asking clinicians to listen, to do what you're doing with me, to ask people to tell their story and to elicit from people what they think is important for themselves, so that the clinicians involved can help them, can meet them where they are, and help them get what they want, not just what the guidelines say. I think his real focus was making sure he knew the human being and valued the human being and his relationship with that person.
We're talking to Michael Fine. He's a family physician, and he co-wrote the Kevin MD article in memory of Bernard Lown. Michael, you mentioned that in a past life you had spearheaded the DPC movement, direct primary care movement. And going forward, what role does direct primary care play in the future of primary care?
Well, I think direct primary care is really important and a really valuable idea. I think it gives physicians a shot at having a reasonable life, and it basically throwing all the check boxes away. It won't help us provide primary care. I mean, it will help us, but it won't be able to totally by itself provide primary care to all Americans, which is what I think we should be focused on. We need to do that in partnership with others, DPC plus others, but it's a critical piece of that, and provides real competition to employed physicians so that employed physicians have a place to go if they get beaten up, as they keep getting beaten up, so that we can model what an ideal relationship between a patient and a physician is. And I think that ideal relationship is you work for the patient and provide unself-interested advocacy. And the DPC movement provides the opportunity for people to do exactly that.
And when you talk about starting a movement, what are some actionable things individuals can do to help grow and nurture that movement?
Thank you for the opportunity. It's actually laid out a little bit in this book called Healthcare Revolt. But what I think people need to do is start in the exam room and start listening to people when they themselves run into the chaos of what purports to be a healthcare system, but is really a market, in the United States. So when a CAT scan gets denied, or when somebody's medications, pharmacy benefits get played with and they have to get all redone, or there's trouble getting a referral to a specialist, as there is in the lives of primary care physicians, many times each day. I think we should be talking to our patients and say, look, we have a mess. We have a market that's there for profit, not a healthcare system that's there for people. Do some talking to your friends and neighbors. And that's one thing we can do. I think we can start inviting people to come into our waiting rooms and having group conversations. I think we can do some things organizing in our own communities, little healthcare systems. So, in the little town I live, which is called Scituate, Rhode Island, we've had something called the Scituate Health Alliance going for 20 years. And we're the only community in the United States I know of that guarantees everyone access. Every single person in Scituate is guaranteed access to primary care. And we purchase that for people without insurance in a capitated way. There are a zillion things people can do. People can run vaccination programs. Many physician colleagues are out right today. I'm going this afternoon to volunteer in a vaccination clinic. We shouldn't be waiting for other people to do that. We should be leading that and modeling how communities can build healthcare systems for themselves. And once we model those, that helps each community start a movement. And then we bring those communities together and begin to build a national movement over time.
And my final question, what's your take-home message for the Kevin MD audience? And perhaps you could end with a final memory that you want my audience to remember Dr. Lown by.
Well, my take-home message is, as you might think, don't mourn, organize. That is to say, don't get upset about the craziness of the market. The market is doing what we ask markets to do, which is make money. Instead, assert the ethical prerogatives of our profession, which means we need to be about unself-interested advocacy. And from Dr. Lown, the quote that most of us remember most is when Dr. Lown said, "If you see the invisible, you can do the impossible." And I think for those of us in the United States, the invisible is the existence of a healthcare system that's for people, not for profit. And the impossible has always been to build it, but it's not impossible if we do it together.
Michael, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for the opportunity again. And thanks for the work you do, bringing us together.